Injuries are a prevalent risk in all athletic environments. There are some injuries that occur more frequently than others depending on the sport being performed. Within American football, ACL or anterior cruciate ligament injuries, especially in a non-contact fashion, occur fairly frequently at an elite level of play. ACL injuries can occur in either a multiplanar or uniplanar muscular function, with both the coaxial and talocrucial muscle actions functioning to influence the torque about the tibial-femoral joint. Through studying playback of when injuries occur, a general pattern of musculature prior to injury has been developed. Increased lateral rotation and flexion of the trunk or pelvis, a flat-footed planting of the foot prior to the injury, and increased knee abduction beyond normal function. These muscular functions combined with force produced through a muscular displacement creates an increased strain on the knee ligaments, particularly the ACL, when combined with a change of direction. Thusly, the resulting injury is a derivative of these combined factors. Between the years of 2012 and 2019, an average of approximately 56 players in the entire NFL incurred ACL tears within their either preseason or regular season. From 2000 to 2020, the average return to play rate experienced by those players with ACL reconstruction was 67.2%. It is a positive figure that over two-thirds of players did return to play, but unfortunately not all could. Additionally, there is a multitude of factors associated with a return to play, such as previous injury, biomechanical function, and genetics. Nutrition has a large role within recovery from an ACL injury. The general focus for rehabilitation for an athlete is sufficient protein, micronutrient-dense carbohydrate sources, and unsaturated fats. The athlete will have an increased inflammation due to the injury, and providing anti-inflammatory sources such as mono or polyunsaturated fats and antioxidants such as vitamin E and resveratrol will aid in reduction in totality of inflammation and reactive oxidative stress. Directly after injury, there is a need for normal inflammatory response to initiate the healing process, but during rehabilitation period, reduction of inflammation can aid the athlete in progressing towards proper function once more. The larger need for maintaining energy balance becomes prevalent to prevent sarcopenia, but the athlete will naturally need less fuel because the injury has prevented normal energy expenditure. Unfortunately, an athlete may create a reduction of calories within their diet, but this can also restrict protein intake. It becomes paramount of maintaining fat-free mass to continue to consume a sufficient protein intake. 2 grams per kilogram of body weight becomes an ingested daily minimum during this period. The function of both protein and carbohydrates becomes supporting sufficient muscle protein synthesis to negate any ill effects of inactivity and to promote a proper recovery period. Thusly, during rehabilitation, a standard of meal timing and meal composition closely resembles an athlete's prescribed diet during resistance training. Both are effectively trying to maintain or grow lean body mass or stave off increased fat mass. Suggested meal frequencies is 4 to 6 meals a day, providing 35 to 40 grams of protein for increased leucine intake, which traditionally equates to about 2 for every 20 grams of high-quality protein, for combating muscle atrophy and natural anabolic resistance during a sedentary rehabilitation period. Prior to bed, ingesting 40 grams of slow-digesting protein such as casein can further aid in muscle protein synthesis. This is paired with a minimum of 2 grams per day of omega-3 fatty acids for promotion of rehabilitation. Overall focus on combating malnutrition and sarcopenia through increased protein intake, anti-inflammatory fat sources, antioxidant-rich carbohydrate sources, and sufficient hydration can lead to an increased ability to return to play of American football athletes rehabbing an ACL injury.